Okay. Once again, good morning, good afternoon, good evening. Welcome to today's Global Network webinar, wherever you're tuning in from. My name is Panya Yu, and I will be moderating this webinar together with my colleagues, Alexander Loschke and Sean Law. This webinar is organized by the Global Network of Data Officers and Statisticians. We are a professional network of now over 3,000 statisticians, data officers, data scientists, and geospatial information experts. We have an online discussion forum where we share knowledge on various areas of data and statistics. If you're not a member already, please do join us at www.jammer.com/UNstats. Today, we are very delighted to have with us José Viera of the International Disability Alliance and Elizabeth Lockwood of CBM Global Disability Inclusion. José and Elizabeth will be speaking about the importance of disability data awareness and capacity building by sharing two disability data resources. That's to say, the Disability Data Advocacy Toolkit and the Disability Data Advocacy Workshop for organizations of persons with disabilities. So some background on their talk. The International Disability Alliance, Stakeholder Group of Persons with Disabilities, and CBM Global Disability Inclusion developed the Disability Data Advocacy Toolkit to contribute to the growing global dialogue on the importance of data on persons with disabilities. The toolkit provides some basic knowledge on data collection, analysis, and use of data for evidence-based advocacy to influence policy and decision makers. An innovative partnership was also established to increase the quality of disability data in the Asia-Pacific region. This partnership was between UNFPA Asia-Pacific and CBM Global Disability Inclusion, in close collaboration with the International Disability Alliance, Stakeholder Group of Persons with Disabilities, and national and regional organizations of persons with disabilities, including the ASEAN Disability Forum and Pacific Disability Forum. A key outcome was a Disability Data Advocacy Workshop for organizations of persons with disabilities, OPDs, a publicly available resource that was recently launched. The workshop aims to introduce the basic concepts and skills on disability data to OPDs and to support applying these in the local context. Let me now just introduce our two speakers. José Viera is the Advocacy Director for the International Disability Alliance. José has also served as the Global Disability Summit Secretariat Senior Manager. In addition, he is the permanent representative of the UN Stakeholder Group of Persons with Disabilities for Sustainable Development, an independent board and an independent board member of CBM Global Disability Inclusion, as well as the former president of the Federation of the Blind of Argentina. Dr. Elizabeth Lockwood works for CBM Global Disability Inclusion as the representative at the UN in New York. She works in areas including the SDGs, disability data and statistics, financing for development, and accessibility. Elizabeth is co-chair of the International Disability and Development Consortium's UN Task Group and an expert member of the World Federation of the Deaf Expert Group on Accessibility. So just a few housekeeping reminders before we go to the presentation. Our speakers will have 35 to 40 minutes to present, and then we will have a Q&A session following the presentation. Throughout the presentation, please feel free to write your comments and questions into the chat box. It's always open. And during the Q&A session itself, you are highly encouraged to ask questions directly by using the raise hand function on Teams. But if you wish, we could also read out your questions from the chat. So once again, this is a Global Network webinar, and the recording and presentation will be made available on our Yammer discussion group. We invite you to continue the discussions there after the webinar. And with that, we are very excited to actually hear from our speakers. So Elizabeth, Jose, the floor is yours. Thank you.
Thank you very much, Panya, and thanks everyone. On behalf of the International Disability Alliance and our partner, CBM Global, it's a pleasure for us to be here. And we have organized ourselves in a way in which we hope to provide all participants with some information, but even more importantly, we really want to have an interactive dialogue. So I will get us started with few general remarks, and then my colleague Elizabeth Lockwood, who is an expert on data and disability, which is not that common to find, will walk us through on some more specific aspect of the topic. Before I get started with our presentation, I really want to acknowledge and thanks the organizers for putting this webinar together, because I think that one of the biggest challenge that we as a disability movement we have ahead of us is actually how to start speaking with people that may not be necessarily involved or connected to the disability agenda, but rather very much involved and leading other agendas. That's how we are going to promote the real inclusion of persons with disabilities. So with no further delays, I just want to check with my colleague Elizabeth. The slide number 2 of our presentation is already on the screen, and we can get started. Thank you, Liz.
Yes, it is.
So there is one question that we as disability movement always like to start asking ourselves before we embark in any advocacy activity. And the question is, why do we want to do this? And in particular, why do we think the data is definitely a priority for the disability movement? There is no possible effective planning, design, implementation, and monitoring of any policy without having data around the population that we want to target, right? So it is clear that for persons with disabilities, the lack of data has been, if not the most important, one of the key gaps that we have identified. How can we think of an inclusive education system in a country if we don't know how many children with disabilities we have in the country, and even more, where they live, what they need, what type of disabilities they have, what type of supports they need, etc., etc. So the key question here is not only why, but more importantly, how we try to address the gaps that we identify around data and person with disabilities. The other thing that we always like to say is that if we really want to be effective in any advocacy action, and that can be from transportation policies to climate action, from housing to employment, and we can go on, we first need data. So we need data to effectively advocate for any of the disability rights contained in the Convention on the Right of Persons with Disabilities that I will be speaking about in a bit. But lastly, I would say that data is important because it allows us to develop also programs and policies and even good practices. Sometimes it's important to recognize not only what is missing, but also how effective policies and programs can be if we have a first good approach to data as the first milestone in any program or any policy. If we can go to the next slide, please. When I was just speaking about why we need data, I was referring to the Convention on the Right of Persons with Disabilities, and I would like to add the SDGs as the main two instruments that not only at the global level has been an agreement around the need for data. But actually, these two instruments, both the Convention on the Right of Person with Disabilities in its Article 31 and the SDGs in the different paragraphs, in the different indicators, and in those 11 references to person with disabilities, there is a clear common understanding around the need for data. So we are not here saying anything that has not been discussed at the global level. However, the challenge remains, how can we transform those international agreements into real practice at the national level? And for that, we need, as I was saying at the beginning, more people involved in other agendas and not necessarily the disability agenda, to be more disability inclusive in order for us to be effective in driving this, what we like to call the data disability inclusive agenda for all. If we can go to the next slide, please. Um, we are saying constantly that if we do not collect data for person with disabilities, we are continuing facing enormous gaps that only result in more discrimination and in more exclusion of person with disabilities. And I don't need to recall ourselves of the consequences of COVID, but I think it's important to use that global humanitarian crisis to illustrate what really means when we don't have data for persons with disabilities. The fact that in many countries around the world, there was no effective collection of data disaggregated for disability, it basically prevented people with disabilities from accessing national emergency response plans. People with disabilities were definitely left behind when accessing, health services. The fact that in many countries, persons with disabilities were not considered in any data collection process basically resulted in not knowing where people with disabilities live. The fact that many people with disabilities living in institutions, which is unfortunately a reality for many of us, and those people living in the institutional institutions in many occasions are not even registered. Basically, those people didn't have access to any sort of response or any plan for COVID. It's a clear example of what we are saying when we don't have data. But it's not only about COVID. If you just imagine the consequences of not having data around children with disabilities in the context of the Ukraine war, it's a clear example of how data in the context of humanitarian responses is needed. We are still struggling with understanding of, with getting to know how many children with disabilities have left the country, Ukraine, and are now trying to find a peaceful and safe space for living in neighboring countries. And of course, Poland, as one example, has reported the enormous pressure that supposed getting children with disabilities with no previous information, with no accurate information and data in their responses to provide shelter to host those displaced people from the Ukraine war. The lack of data in the field of employment, in the field of education, in the field of social participation are other examples that illustrate what it means not having data. So I really want to emphasize what are the consequences of not having data. Basically, the fact that we don't have data is, if not the most important reason, one of them that are preventing us from a full enjoyment of life as a person with disabilities. If we can go to the next slide, please. Um, there is always space for hope, and there is always a space for doing something. And we as a disability movement are committed to transform this agenda of data to be more inclusive, to be more participatory, and to actually be meaningful for a person with disability. So the disability movement is usually structured in all the countries around the world through their representative organizations. So I'm sure all of you know an organization of person with disability, and it's key to engage with those organizations of person with disabilities. Person with disability organizations are usually the first space where person with disabilities go to have services, to get services, to have rights fulfilled, etc., etc. So the amount of information that organizations of person with disabilities are creating and generating around person with disabilities, it's incredibly important. Person with disability organizations can also, based on data, evidence-based approach, be effective in advocacy for other agendas, as I said before. And lastly, the fact that we are including persons with disability organizations in the different discussions around data can also allow us to plan better our work. That's why we say that organizations of persons with disabilities are effective in requesting information to be collected by those who have to in the context of different governments, to use the data for our advocacy purposes, and even more important, to support government agencies to plan and implement different programs and to be effective in terms of disability inclusive approach. If we can go to the next slide. um, we try to always find a space for everyone, right? So I think that through collaborations, and we have one that CBM Global Disability Inclusion is part of, and the IDA is also getting engaged, which is the LNOB partnership that Elizabeth may speak about a little bit more in details, are good example of these partnerships where organizations of persons with disabilities, development stakeholders, government representatives come together and discuss how can we work together. We know what we can contribute with, but also we kind of play this double role of being a contributor to the agenda, but also as a reminder for those who are in different positions to collect more data on persons with disabilities. We have learned that there are many ways, from advocating with governments to strengthen the capacity of statisticians to collect data and to be more aware of disability inclusion. But there is one thing that we are more and more trying to engage, because we really think is an effective way, and I will ask Elizabeth to go to slide number 7, and that is citizen-generated data. As I said before, just a very simple example. Organization of Persons with Disabilities registries are a fantastic tool to collect data. Person with disabilities, we usually go to our organizations, the local organizations, to request a white cane if you're blind, a wheelchair if you have a physical disability, how to get support to be included in the education system, etc., etc. So the amount of information that we are generating as persons with disabilities is something that we think it should be used. It cannot be dismissed. It cannot be undermined. And that's why we understand that citizen-generated data adjusts very well to what we need. It adjusts very well to what we can contribute with, and it's showing how we can be flexible, effective, evidence-based, high quality, and even more important, dynamic when it comes to data collection. That's why we are committed to advance the citizen-generated data agenda as a key player in collecting data, but also as a beneficiary, if I can use that word, from other stakeholder group or other stakeholders' actions around citizen-generated data. I will pause here, acknowledging once again of the importance of this webinar, particularly with regards to the audience that is present here. And I'm sure that Elizabeth will provide more details regarding what we are currently doing. So thank you very much, and over to you, Elizabeth.
Thank you so much, Jose. And I'm just going to switch gears a little bit now and talk more about our resources and tools that were mentioned in the introduction. So as a group together, as Jose mentioned very nicely, when we work together, we create tools that are effective, that can really build capacity of organizations of persons with disabilities, but also national statistical authorities and others involved in disability data. So One thing that we have learned is when you train enumerators on disability awareness, that you have a higher prevalence. And so this is something that we recommend, we encourage very much. And we also think that another way to do this is to train organizations of persons with disabilities to be enumerators themselves. They know their communities the best, they know where their community members are located, what the barriers are, and this is particularly important in emergency situations like Jose has mentioned already. We also think it's important to have international comparability, so to have capacity building on the Washington group questions as a tool for censuses and surveys, and we will talk about that a little bit later in the Q&A because that was one of the free questions we received. But we also want to mention that there are other tools, but this is the one that really is standardized. So we encourage that because there is a lack of disability data globally. And so the tools I'm going to mention, we've already had an introduction to those. So I will just go right into those. I'll start with, technology, the toolkit. The Disability Data Toolkit emerged from a lot of discussions around disability data with organizations of persons with disabilities. We found that in our work at the UN doing disability rights advocacy, that there was a real need to understand data, disability data advocacy better from our organizations. So how to use data, how to find data, and how to advocate for better data. And so this was the impetus for us as a collaborative to really create this data toolkit, which we created a few years ago and launched at the World Data Forum. And the idea behind it was really to be a guide. So it explains where to find data, how to use data, what is good data, what's important about data. And then we also have case studies in the toolkit from the Pacific and from the Leave No One Behind partnership that looks at community-driven data in a few countries to monitor the SDGs for marginalized groups. And then we also have a timeline of all our advocacy on data toward the SDG indicators. And this is something that we've translated into Arabic, English, French, Spanish, easy read format, and international sign. And we hope to have more translations when we have more resources for this. And we are currently going to assess how it's being used and update the toolkit. So it's really a living document that has really, I think, had great impacts on the community that we work with and also partners such as yourselves. And from this toolkit emerged the workshop for organizations of persons with disabilities. So this came from UNFPA Asia Pacific. So I really want to thank them, especially if they're here today, for their support in this. They really wanted to strengthen disability data in the Asia Pacific region. And so they came to us, CBM Global, and then International Disability Alliance and other partners on how we could strengthen. So one of these ways was to create a workshop for organizations of persons with disabilities. And another way was to do a mapping of disability data in the region, which has been done. And another was to create documents such as an little infographic explainer on the Washington group questions. How do you use disability data? And I'm happy to share those links later. But what we did find from the mapping, unfortunately, is there are really not a lot of disability data in the Asia Pacific region, especially when we framed it against the SDG indicators and the Incheon strategy indicators. This isn't surprising, but it is unfortunate. So I think that this is a great motivator for us to work to strengthen more disability data and have more disability data. But back to the workshop, the objectives of the workshop were to really show OPDs, organizations of persons with disabilities, how you could collect data, where you could collect data, how you could advocate for better data. So really building on the toolkit, but going further. And then also, how can you apply this knowledge, these data literacy skills in the local context, and how you could have a data advocacy plan. And the idea behind this was really to have it more interactive, have it hands-on, and an open source. So that was the number one thing. We really wanted this for everybody. It is launched. It was launched in April, so anyone can use it. It can be online or in person. It's split up into 8 modules, but the nice thing is you can use a few of them or all of them. And it starts really with more, okay, how do you disaggregate by data? Why do you disaggregate? Information on the Washington group questions and how to use them, their cutoff points. And then it goes more into how do you create an advocacy plan? How do you carry it out? And then follow-up steps for organizations. What is really wonderful about this workshop is that we have facilitation guides, and the organizations of persons with disabilities are the ones leading the training, the workshop. And so there's a guide for that lead or leaders. They should have some data knowledge, and then they can do it themselves. That's much more effective. And we found that in the pilots that we did last year, that we have a varying degree of data knowledge in the groups. So this was really important. We had pilots in Nepal online and in person in Samoa. And we found that this was really helpful to have both, to see how both of them worked. And here's some of the feedback. What we found was that, not surprisingly, in person was much better than online. And I think we all know that. And that linking the materials to the local context was particularly important. And both trainings did translate the workshop, so that's very important into the local language. So I think that's something that we need to support, to have those language translations, to have accessibility into international sign or the national sign language. It was really important that to have that literacy development on the Washington group questions, because a lot in Samoa, in both countries, I don't think in Nepal the Washington group questions are used, but in the Pacific region they're used very much, and it's been very successful. So I think that understanding of how it's being used in the Pacific and Nepal, if they want to use it, that was also very helpful. So I think that that comparison was good. And then there was a need to actually have another training, maybe to go in more depth. So that's something that we will look into developing in the future. But as current status right now, we have a training that will take place with UNFPA's support again in Laos this year online, and a training in the DRC in French that will be in person. And then we will do a training in Bolivia early next year in Spanish. So we will take the findings from those and assess, and then come back and update again. And I think I will end here, and happy to answer any questions. And thank you so much as well for inviting us and having us here today.
Many thanks, Jose and Elizabeth. That's a very insightful presentation. Thank you for providing the background on why data is important, and then going also into concrete tools on what people can start using, right? And congratulations on the launch of the workshop. So we're going to now open the floor for questions. As I said earlier in the meeting, at the beginning of the meeting, your mic and camera is now allowed. So please feel free to use the raise hand function and let Elizabeth and Jose know if you have any questions. So at the top of your screen, you see the sign basically to raise your hand. Please use that, and it will call on you to ask questions. Okay, we have a hand from a couple of people. Let's go first to Isabella. Go ahead, Isabella.
Hi, thanks a lot, Jose, Maria, and Elizabeth. I think this work is really very important. I work in Eastern Southern Africa Regional Office of UN Women, and my portfolio is gender data and statistics. We recently did a cognitive testing on the mental health module of the Washington Group. And not just during that process, but also in my contact with national statistical officers, we are getting a lot of pushback on that module. And I personally really like it because it's functional. It's you know, measuring, trying to standardize a measurement, which is extremely difficult. But the pushback is always from the disability sector, and the pushback from the disability sector is that they believe that the incidence of disability is actually much higher than what is picked up by the set of questions that's really mentioning measuring functional disability. So I'm not sure, in your work on around data advocacy, was this an issue, and did you include that in your materials? Thank you.
I don't know if we will take some more questions before we respond, or what are the arrangements? Otherwise, I'm happy
What would you
to.
prefer, Jose and Elizabeth? Would you
No,
like to just
totally,
take on that
totally up
question?
to you. Totally up to you.
Maybe let's take that. Let's take that, and then we will take on in the next round. We'll take on a couple of questions.
Sure.
So
Thank
go
you.
ahead.
Thank you. Elizabeth, Isabella, thank you for your question. I would, if you agree, Elizabeth, I would like
Yes.
to share a few comments first from a disability point of view, a disability advocacy point of view, and I'm sure that you, Elizabeth, would have more information with regards to this particular set of questions. Isabella, your question not only is a very important question, but I don't know if
Please mute yourself if you're not speaking. We hear some audio feedback.
because they've not filled the quotation form. I don't know, this RF or something. RFQ.
Okay, go ahead, Jose.
Let me try. Yeah, sure. Yeah, thank you. But I think your point about whether or not the disability community is pushing back on some specific areas is even more important. With the Washington Group of Question, the disability community has worked significantly over the last couple of years and very well. So we see the Washington Group as an ally, right? But it's true that in general, the set of questions produced by the Washington Group, and in particular this mental health set of questions, has created, I would say, a natural discussions and debates, right? Not necessarily about the results of the questions in terms of how many people with disabilities are identified through this methodology, but in a way, if it's the best tool that we can use, especially when trying to capture the mental health component of disability, right? And that's why I'm saying that maybe promoting dialogue with national OPDs and the disability movement is needed. First, to also hear what they have to say, and I have to be very clear here. There are different views regarding the mental health set of questions. But even more importantly, I think what you are saying, Isabella, is a good example of the need for having dialogues across national government agencies, OPDs, international agencies, the UN system, etc., to agree if what we are going to implement, in this case, the Washington Group set of questions with regards to mental health, is exactly what the disability community understand is needed. In short, what I'm trying to say, what you are saying here, what you are sharing here, is a good example of maybe a good reflection that we should make in terms of how much are we engaging with OPDs in advance of implementing different methodologies for data collection. Elizabeth, I'm sure you have not only a better answer, but a more evidence-based answer, but over to you.
No, not at all. Just to add to this, we are aware of these questions, the question sets being tested, and I think they have a long way to go. I think they're very important because the other sets do not include psychosocial disability, do not include other groups like autistic people. So I think it is very, very important to have something like this. But like Jose says, you have to have consultation with the psychosocial disability groups and in different ways, not just in a few countries. And I would say that the prevalence issue is a lot of it is around the cutoff point. So that's another discussion. But I do think when you have a low prevalence rate, that gives a government an excuse not to give support or services. So it is a real concern. So I do think this is something that should be addressed. And I would say that we need a lot more time and a lot more consultation with OPDs to work on these. Yeah, that's it from my side.
Thank you, Isabella, for a great question and comment, and thank you, Jose and Elizabeth, for your responses. I'm going to go to the floor and take a couple of more questions, but when you answer those two questions, Jose and Elizabeth, I would also like to hear a little bit more about what the Washington Group on Disabilities is, because there is also a question in our registration form to ask you to explain more about that. I'm sure it's bread and butter in your work, but for lay people who are not very familiar, it would be very useful to kind of understand that a little bit more. Okay, so I'm going to take two questions in this round, and I will give the floor to Mona and then Sophie. Go ahead, Mona and Sophie, please unmute yourself, turn on your camera and ask your questions. Mona, are you still there? We see you, but we don't hear you. Okay, but while we wait for Mona to maybe reconnect, Sophie, can you go ahead with your comment or question?
Hi, everyone. Can you hear me okay?
Yes.
We do.
Yeah. Okay, excellent. So I have a comment, but maybe it would be better for later because it's about the Washington Group questions. But shall I come back in a little bit? And it's related to Isabella's point, Isabella, regarding prevalence rates.
All right, so yeah, we can come back later after we have heard a bit of an explanation of what the Washington Group is. Let's try one more time to go to Mona. Let's see if we can hear you this time. Mona, if you still with us, unmute yourself and ask your question. Okay, she typed in to say that her microphone's not working. Mona, we could also ask the question for you, so just feel free to type your question into the chat and I will read it out for Jose and Elizabeth. We can now probably go to another question first while we wait for you to type it out. Abdul Mumuni Suleiman, please unmute yourself and ask your question.
Greetings to everyone. Fantastic presentation. So specifically on the Washington Group set of questions, my worry is that a lot of people want to know about the work, the intervention in Africa, specifically the English-speaking Africa. Because from my observation, yeah, I am from Nigeria specifically, and we have a lot of issue when it comes to the usage of the Washington Group set of questions. We were supposed to do our own national census some months ago, but they kept postponing it. And then from the survey for the national census, a Washington Group set of questions is not well captured in the set of questions that the enumerators will be used. though a lot of people, a lot of organizations of persons with disability did advocacy to the National Population Census, but there was no in-depth knowledge about the usage of the Washington Group set of questions. And I think also this applies to West Africans also. So yes, I think that there's also need for us as we collect the disability data to have the in-depth knowledge.
Thank you very much for your question. Just for Jose to know, the question was asked in sign language, and thank you also for the person who did the interpretation. So I think now it's as good a time as any to go back to you, Jose and Elizabeth, to respond directly to the question from Suleiman, and also to tell us a little bit more about the Washington Group. Over to you.
Thank you. And nice hearing you, Suleiman, always. Thanks for joining this webinar. I mean, we as a disability community have concluded that the Washington Group set of questions is the best tool available that we have in terms of collecting data for person with disability when it comes to some specific areas of the topic, right? Of course, we understand that there are some challenges that is and I can my list of issues regarding the Washington Group of Question is quite extensive. But what I would like to be very clear about is that we cannot not kind of having discussions around data collection, etc., because we think that the Washington Group tool is not the most effective one. And I was saying, like, issues are many, from translation to interpretation, the way that the questions are presented, the need of more training for enumerators to really ask the question in a proper way, the stereotype around disability that we need to fight against when it comes to national census, etc. But I think the Washington Group set of questions give us the chance, A, to open this conversation and to have a frank conversation, and B, at least a tool that allow us to collect some important, relevant, and useful data. We do know good practices and good examples of how the Washington Group set of questions used in a proper way are giving us more space for advocating for better policies at the national level. So that is this is kind of the position of the disability community that we represent, always reminding ourselves of the need of engaging OPDs right from the beginning if you are thinking of implementing any tool when it comes to data.
I'll just add in there I completely agree, but just a little bit of background. The Washington Group on Disability Statistics was established in 2001, and the idea was to develop a standardized disability data collection tool for government and censuses and big surveys. So it's really for big data sets and to have an internationally comparable disability data system. So I think this is very, very important. So it's really important for the Convention on the Rights of Persons with Disabilities and for the Sustainable Development Goals and for these sort of things. And we are seeing when we don't have this, we only have 2 indicators, SDG indicators, that have comparable data. And that's the problem that we find. Of course, there are many, many gaps, but like Jose was saying, this is what we have. And then we support the Washington Group short set, especially, and the child functioning module from UNICEF and Washington Group for children with disabilities. There are other sets, and those also can be discussed at another time, but they can be adapted, they can be included into different surveys. So I think that's also good to know. But I also think for smaller surveys or disability focused surveys in countries, this is also very important, like Suleiman, you were mentioning. And I think if the statistical community is not trained on the Washington group, then they won't be applied correctly. And that's, really replying to Suleiman's point. Or if they only use 3 of the questions, or they change it, that can be another issue. Or Sophie will probably mention that if the cutoff is different, then you're going to get a lower prevalence rate. So I think these are all really important points, but I think this is what we have, and it's really, really important. And someone mentioned in the chat box, could we have a Washington Group 101 webinar? And I think that would be a really good idea from the Washington Group. I'm sure they'd be willing to do that. And it is used in many, many countries, over 100 countries. So it is a very important tool. I also wanted to answer, I think it's Mona's question about, can we do this work in the Philippines? And definitely, and I would like to add that the Philippines is a great, great country that works on citizen-generated data. And I've really seen this with my work with the UN Statistics Division and the SDG indicators. And we actually have a report we'd be happy to share that was led by organizations of persons with disabilities and women with disabilities in the Philippines, where they created their own disability registry. And they were the enumerators, they were the data collectors, they were then they analyzed the data, they did everything. So it's a really wonderful example of a project in the Philippines that is now extending to the outside of Manila. So it started in little cities and now is growing. So we'd be happy to share that as a very good practice, good example. I'm happy to share that later. But I don't know, Jose, do you want to add something else here? Or maybe Sophie, if you want to come in, because I know we know Sophie very well, and she's also an expert on this. So maybe this is good.
And Sophie should be on this side of the table with us.
Yes.
So,
yeah.
And
Yeah,
maybe
please go ahead, Sophie.
before Sophie gets the mic, just proposing here to the organizers, maybe a meeting to discuss with Washington Group colleagues can be something to consider. I think there are a lot to be discussed, and I'm sure that Jennifer and other colleagues at the Washington Group will love to have this conversation with you. So just an idea.
Yeah, and we'd certainly love to host a separate global network webinar on this as well. Let's talk after this, Jose and Elizabeth, so that we can get contact to the right people to try to organize something. And thank you to Soleil for suggesting this. We'll certainly take it into account. And if we do that, we certainly will advertise the webinar to the whole membership of the global network later on. Sophie, please come in now. I understand that you also have some comments on this topic.
Yeah, thank you very much. And thank you for an excellent set of presentations earlier. No, I wanted to just make a note, and Elizabeth already mentioned this, that when it comes to using the Washington Group short set, so each answer to the 6 functional difficulty questions, like do you have difficulty seeing even when wearing glasses, each answer is a 4-point scale: no difficulty, some difficulty, a lot of difficulty, and unable to do. So depending on where one sets the cutoff for on the answer scale, the prevalence rates can vary. And the groups of people with disabilities vary. So you don't have to just create one group of persons with disabilities. You could create several groups depending on the degree of functional difficulty. So that really influences the prevalence rates, as well as the inequalities that are put into light with the, when you analyze outcomes like poverty, employment, education, attainment. So that's what I wanted to mention, the Disability Data Initiative and the latest report that came out that was launched at COSP. I'll put the link of the website. Like for Kenya, where the cutoff was put is a good example, because in the official analysis of the Bureau of Statistics, the cutoff was placed at least a lot, while we put it at some difficulty and above, and the prevalence rates went from about 3% to about 12%. And regarding the point mentioned by Sule, in our 23 report, we have a few countries from West Africa, and I'd be happy to discuss further, but we did find quite a bit of variation from country to country in the results, not so much in the overall prevalence rates, but more in terms of gender patterns. Like usually we find higher prevalence rates for women in the countries we've worked with in the past, but for several countries in West Africa, that was not the case. So I think then it comes to understanding better maybe how implementation of the questions was done, maybe the training. So that would be an interesting conversation maybe to continue. Thank you so much.
Thank you, Sophie. So that's more of a comment than a question. Do you have anything to add to that, Elizabeth and Jose, to what Sophie just said?
Jose, or do you want me to go?
You can go, Elizabeth. Huh?
I was just going to add, I mean, Sophie, you're such a wonderful partner, and we really, really value the work that you're doing in the Disability Data Initiative. And also, I think you really touch upon the point of how we need more data on intersectionality and those groups most left behind, like Indigenous women, deaf sign language, national sign language users, lots of people who are left out, autistic people. And I was just trying to collect data on women with disabilities, and it's very hard to find. I mean, and so while we are talking about general disability data, we also really need to look at the intersectional pieces. I think that's really, really important. So I think, more of this work, strengthening this work is very helpful. And then using citizen generated data, including qualitative data in that, is very, very important. So I'd really strongly like to recommend that and support the collaborative on citizen data that's being developed by UN Statistics Division. And we're a part of that, and we're very pleased. I think this is a great start to this conversation. Jose, I'll pass it to you.
Thank you, Elizabeth. I don't have much to add. Thanks, Sophie, for always being an ally to the disability community, and I'm sure that you have already, but if not, the global network can be a perfect channel through which you can share how you prioritize the perspective of OPDs and how you're engaging with OPDs like IDA and many others, and fulfilling this expectation of meaningful consultation and permanent engagement with OPDs in any discussions of this type. So thank you, Sophie.
Thank you indeed, Sophie, for your great comments. And yes, indeed, I encourage you to join the global network and continue the conversation there. We are always in need of people who bring a strong perspective on an area of expertise like this. So I have shared the link in the comment section, and I hope to see you there as well. We have less than 5 minutes to go, so let me try to take one or at most two more questions. I want to switch gears slightly, Jose and Elizabeth, and bring up one of the questions from the registration form. This person asked you that he or she wants to know more about the digital divide faced by disability group. So it would be great to hear your thoughts on that, please. Over to you.
It's hard to respond that question in less than 5 minutes, but let me be very precise.
I hope you try your best. Yeah, we can go over by a couple of minutes if required. No worries.
I mean, the lack of assistive technology available for a person with disability is definitely the first thing. The second aspect that I would really emphasize here is the lack of connectivity that people with disabilities are facing when it comes to any aspect of life. Again, COVID made us go more or less on a internet world all the time, and there was very little, if nothing at all, regarding how many people with disabilities can have access to internet connection. And the last thing is that assistive technology supposes a cost for person with disabilities. So the fact that we are not being effective in implementing policies and programs that will enable people with disabilities to have the financial resources to access to assistive technology will continue resulting in higher exclusion of persons with disabilities. So money, connectivity, and availability for me are three key elements that are speaking directly to how far behind we are in terms of the digital world.
Thank you. Elizabeth, anything to add to that?
Nope, Jose said it perfectly. I'll just add that I did post a link in the chat. It's a really extensive document on the Washington group that my colleagues from CBM Global, but also the Nossel Institute just launched. So I think it might be really helpful as a guide to look at.
Thank you for sharing that. And yeah, it's been an hour. It's been very insightful, very engaging. Thank you to both of you for your presentation, for taking time to speak to the group today. Thank you also to everyone who took time out of your busy schedule to attend. This has been a very participatory and engaging session. So I thank you all for that. Unfortunately, we only have an hour. I think we still have a couple of more questions that we could have gone through, but I think this is a good start. For now, before we say goodbye, can I request the participants who can to just unmute yourself and turn on your camera and just give a big round of applause to all our to both of our speakers, if possible, please. Thank you both.
Thank you.
Thank you everyone.
Thanks so
Thank
much.
you. Thank you, everyone.
Thank you.
Thank you, everybody. Have a good day and hope to see you at the next Global Network webinar. Bye.
Thanks. Bye-bye.
Thank you.
Thank you. Bye.